Hello, my name is Dr. Philip Kwan, and I am the Chief of Anesthesia here at New Look New Life. Today we're talking all things anesthesia and what to expect when you come in for an operation here at New Look New Life. Anesthesia is the inducement of unconsciousness during surgery so that the patient doesn't feel any pain and doesn't remember the procedure during surgery. We don't really know all the technical aspects of anesthesia, but basically the drugs that we give quiet the neurons within your brain to the point that they are no longer able to form memories. And so that is the way that we are able to get patients through surgery without remembering. Anesthesia is very misunderstood field because most people are unconscious when it happens, right? You go to a neurologist, you go to a cardiologist, you speak with a physician, they do a procedure, they tell you what's happening, you're able to witness it, no problem. Whereas with anesthesia, the patient is unconscious most of the time. So nobody really knows what happens. In addition, after the surgery is done, people are still waking up and the anesthesiologist, after making sure the patient is safe, has moved on to the next case. So we really don't remember our anesthesiologist who is taking care of us. And that's why it's so terrifying. I mean, of course, yes, you are unconscious and fully in the hands of the anesthesiologist, right? They control your blood pressure and how fast your heart beats and how fast you're breathing. So your life is fully in the hands of the anesthesiologist. However, that's why we train and that's why we practice vigilance and make sure that all our patients are safe. So there are many types of anesthesia and many different levels of anesthesia. Local anesthesia is the most basic one where the surgeon injects local anesthetic, such as lidocaine, into the region that they're operating on. You won't be able to feel that part of your body while it's being operated on. However, you are conscious and you're remembering everything. Then we progress into sedation, where IV medications are given. Often it's called twilight anesthesia. You are still conscious and responding to commands. You may or may not remember some components of the procedure, but you're still breathing on your own. In general anesthesia, you are put on a ventilator, the machine is breathing for you, and you are completely unconscious and not able to move during the surgery. Yes, with the technology that we have now, anesthesia is very safe. We are able to monitor a lot of the processes of the body under anesthesia. For instance, nowadays we can track your heartbeat from beat to beat. We can look at your oxygen levels as it pulses through your blood vessels. In more invasive forms, I can look at your blood pressure from beat to beat as well. I can monitor cardiac output. We have machines and technology now that make anesthesia very safe, and I can tell what is going on almost on a second-to-second basis and course correct. There are risks and benefits to each type of anesthesia. With local anesthesia, you remain conscious. You remain a little bit more in control. However, that's not always what's best for the surgeon. If you start feeling uncomfortable or you start feeling pain, you're able to move around. As a surgeon is cutting on your body, that is the last thing that they want, is for you to make a sudden movement with a scalpel or a cannula in their hand and enter an area that they were not intending to enter, but because of the movement, they accidentally cut somewhere they didn't want to. With general anesthesia, because you are completely motionless, the surgeon has more control over their technique and they're able to often generate better results because of that. We don't know that completely, partially because that is based on the patient's personal metabolism. What we do know is that anesthetic drugs are eliminated over the next 24 hours after surgery. With general anesthesia, oftentimes you will get an anesthetic gas that is breathed off within about 12 hours or so. If you receive IV drugs, that can remain in the body and will be cleared by the liver and kidneys within about 24 hours. However, clinical effects of these drugs will wear off within the next 10 to 15 minutes after being given. During anesthesia, you are given IV medications, you are given anesthetic gases, And in order to maintain anesthesia, I have to continue giving you those drugs. Otherwise, a patient will wake up after about 10 minutes when we stop giving the drugs. Pain is a complicated process. And in order to control pain, we have multiple modalities. Most often, we think about pain control as narcotics, giving powerful medications that hit certain receptors that take away pain. However, there are detriments with that because they also stop your breathing, and so that's why doses need to be controlled very tightly. More recently, there has been a push towards non-narcotic or non-opiate pain control, and that's why nowadays in surgery we give a whole bunch of medications that are adjuvants that help with pain, such as IV Tylenol, ketorolac, dexamethasone. These are all medications that can help reduce the amount of pain without opiates. With general anesthesia, you have a specialist who's in the room who is concentrating specifically on you and watching over your vitals while the surgeon performs the procedure. This enables your surgeon to concentrate on the surgery and producing the best result without having to worry about you moving or what your blood pressure is, or whether you're comfortable. With local anesthesia, the anesthesiologist is not there. It is your surgeon who is responsible for making sure that you're comfortable. They're more distracted that way. They may be a little bit more conservative or have to modify the procedure in order to make sure that you don't feel pain or terribly uncomfortable. Oftentimes, these modifications in the procedure do not generate the best result. And so general anesthesia may sound scary, but it is actually probably the safer route because you have two people there, and the route for the best result because your surgeon can concentrate specifically on their technique. With local anesthesia, the main risks are pain, intolerance to the procedure, and inability to complete the procedure due to an incomplete block. Surgeons will often infuse more local anesthetic in order to try and block more pain receptors to complete the procedure. Sometimes this is called a super wet technique where they give more medication. However, the problem is that our bodies have a limit to how much local anesthetic it can tolerate. When you overdose on local anesthetic, then you start developing cardiac arrhythmias and blood pressure problems that can ultimately lead to death. Local anesthetic systemic toxicity is very difficult to come back from, so surgeons are often very wary of giving too much local anesthesia. However, in an effort to make the patient comfortable, sometimes they try and push the limits to get the patient through the procedure, but this is not necessarily always the safest thing. With general anesthesia, the medications that we give do basically give the heart and lungs a little bit of a workout. Your blood pressure may drop because you're not breathing on your own and a machine is breathing for you. It's a little bit irritating to the lungs. However, people who are generally healthy tolerate this without any problem. We give thousands of general anesthetics around the nation every day without issue. There is a slight chance of further complications, including death with general anesthesia, but that is also true with local anesthetic if an overdose of lidocaine is given. Thank you for watching this video. I have had fun interacting with you guys and answering questions. If you have any further questions, I am available on our website at www.newlooknewlife.com. We are here to answer any other questions that you have and support you guys through this journey. Thank you once again, and I will see you in the next one. Bye.